I'm now absolutely delighted to be joined by the M.P.A CEO and Medical Director, Dr. Saul Levin. Well, Dr. Levin, welcome.
Thank you very much. It's a pleasure to actually be sitting here after 6 months in the job.
And quite a baptism of fire, hasn't it been, those 6 months?
It has been. One has been a very exciting time for psychiatry, with mental health parity finally being passed, and now we have a big mental health bill that's now beginning to go through the House of Representatives. It's actually a really exciting time for psychiatry.
Talk to me a little bit about what are some of the main priorities that you have at the M.P.A right at the moment.
So I've been a member at M.P.A since 1986. I've sat in a lot of councils and committees. I know the organization from the membership side, and I still am a member. But now as the CEO Medical Director, it's how do I see us moving psychiatry into not just the 21st century, but also with the healthcare reform system changing in this country. How do we ensure that all our psychiatrists are adequately prepared for the changing system? So I have three big issues that I think we're concentrating on.
Right.
One is membership. We're a membership organization. We need to respond to our members. They're the lifeblood, and also they're the ones that energize all of us in the staff, as well as take care of all the patients in this country. So you're going to see a very big turning to how do we become very membership focused. The other part is partnerships. We cannot do it alone. We need to have not just the other subspecialties, allied health professionals, but also we've got to have the consumer organizations with us. So we're going to really look to creating those partnerships a lot stronger that has been in the past. And last but not least is what you've mentioned, is the strategic issues.
Right.
What is the issues that we now face? And the big issues are obviously the Affordable Care Act, and how do we ensure that psychiatry integrates back into the House of Medicine and ensure that we, along with our primary care physicians, take care of those patients in the way that we've been trained to take care of those patients. And then we've got parity, both at the national level and at the state. And how do we ensure that no illness, mental illness, is treated any differently to diabetes or hypertension?
Let's talk a little bit about this conference. Always, obviously, one of the highlights of the calendar. What are some of the things that you might be looking forward to the most at this year's conference?
Well, one, just being here in New York. This is always an energizing city.
Sure.
So it's always wonderful to be here. But two, I think with July being the National Mental Health Diversity Month, we've got a whole new track for people who are interested in the diversity issues and how it affects mental illness and our patients, that they could literally go to our app that we have, and you can find out all the different lectures. I think that's going to be one of the really important areas that are happening here. The other one is international. M.P.A is getting more and more international psychiatrists wanting to come, not only learn our knowledge we have, but also exchange theirs.
Glad to hear that, by the way.
Good, yeah. Well, for you and for me, both people who've now come to this country, that's important. And it's important that we're now international and we're global. Mental illness is global across the world, as is some of the primary care illnesses. So we need to really look at our colleagues around the world and exchange the best ways to treat on a population basis.
You talked about partnership as one of your main planks. So what are some of the things that we could look forward to at this year's conference that would underwrite that?
So I think the big issue is integrated care. Clearly with the Affordable Care Act, we know that both the federal government and the private insurers are now looking is how are we patient-centered and how do we integrate our care? How do we, and the primary care physicians and nurse assistants and nurse practitioners and psychologists and social workers all function as a team for the betterment of the patient. We have a number of great educational tracks that you can go and learn from your practice, no matter what your type of practice is, as to how you can integrate into care.
Now, the M.P.A has always done a great job with social media and keeping up to the times and the way that it communicates. But I understand you're the first CEO that's going to be leading that charge.
Okay. I love Twitter, I love Facebook. To anyone listening, I love you to become a follower. It's at DC Doc Tweets. And we'd love you to follow us because, you know, it's a conversation. I'll get you out what's the latest information, and then you, by your retweets and when I begin to follow you, then get your information. So it's a two-way conversation. I believe we're going to reach a much larger audience, both physicians, healthcare workers, but also, above all, the patients and their families.
Well, we'll look forward to that. And Dr. Levin, thank you ever so much indeed for taking the time to talk to us.
It's my pleasure anytime, and welcome to our annual meeting this year.
Thank you.